Good morning, dear students. Today, let us see about toxicological screening method. So, already in first sem, you have pharmacological and toxicological screening method. It's a continuation of that. We have toxicological screening methods too, separately related to the toxicological aspects we have. So, before entering into the syllabus concern, let us try to understand the difference between pharmacological screening and toxicological screening. This is scope and objective what you had in the pharmacological and toxicological screening. The pharmacological screening was designed to impart knowledge on preclinical evaluation of drug and other experimental techniques involved in the drug discovery and development. So with the help of that, the students can understand the maintenance of laboratory animals as per the guidelines and also the basic knowledge of various in vitro and in vivo preclinical evaluation process. This was the scope which was given for pharmacological screening. For semester 1, we are not focused much on the toxicological aspects, but generally we came to know about the handling of animal and various procedure involved in vitro and in vivo for preclinical evaluation. As we know, like preclinical evaluation or screening is the first step in the drug discovery process before starting the clinical trial. So preclinical studies will be conducted. So where we will be checking about the pharmacological action, whether the drug is having pharmacological action or not, and also we will be checking about the safetyness for the human volunteer. Before entering into the phase 1 clinical trial, we will be analyzing about the safety dose by taking various animal models. This was the intention behind the pharmacological screening method. So objectives was fixed like upon completion of the course of the student shall be appraise the regulation and ethical requirement for the usage of the experimental animals, describe various animal used in the drug discovery process and good laboratory practices in maintaining and handling of the experimental animals, and also describe various newer screening methods involved in the drug discovery process. Even if you observe the syllabus was framed according to this, like where we came across with the newer technique also, and also generally we came across how the grouping of animal will be done and how the comparison will be done, and also we came across with various in vitro and in vivo process. This was information related to the pharmacological screening what you had gone through in semester 1. Let us move on to the actual subject what you have, that is the pharmacological and toxicological screening method 2. Here much of the information will be focusing towards the toxicological screening. Let us see the scope of the subject. So this subject imparts knowledge on the preclinical safety and toxicological evaluation. So now if you compare with the pharmacological screening where preclinical studies was involved, but there we were focusing on the pharmacological action, like preclinical evaluation was done, but here preclinical safety and toxicological evaluation both will be done with the new drug and other chemical substances. What is the use of studying this subject? So this knowledge will help the students to work in regulatory toxicological evaluation. So now while talking about toxicological branches, I will be talking in the next slide. Regulatory toxicological evaluation. Regulatory toxicology is a branch of toxicology, so where they make many of the regulation, because many chemicals may cause hazard to the human beings, but even though they will be present in the market, but certain guidelines should be made. So this regulatory toxicology branch will make such guidelines for the government, and the government later they will implement. Without the permission from the regulatory toxicological department, so now we won't get any license for selling of the toxicological substance. Like you may think like why that such toxicological substance or chemicals should be used. As you know, many of the pesticide, insecticides and many of the other chemicals which may be used to kill the insects and pests, so they may cause hazard to the human beings, but toxicological evaluation will be carried out earlier. So then a proper guidelines will be made. With the help of that guidelines, such market will product will be in the market. So this information completely will be gained upon having complete information about the toxicological screening. So this is the scope. Once you have complete information about the toxicological screening methods, so that you can work in regulatory toxicological evaluation and you can contribute for making certain guidelines about the precautionary measures which will be taken during using hazardous chemical substances. Now see, objectives of pharmacological and toxicological screening. Now even the syllabus is framed according to this. Upon completion of the course, the students shall be able to explain the various types of toxicological study and appreciate the importance of ethical and regulatory requirement for the toxicological studies and demonstrate the practical skill required to conduct the preclinical toxicological studies. Up to now you have a knowledge about preclinical screening of various drugs for particular activity by using selected models. Now upon completion of toxicological screening, here also will come across with lot of regulatory guidelines for conducting the studies, and also you will come to know how preclinical screening can be done in the toxicological products. So now before entering into the syllabus, generally let us try to understand the meaning of toxicology. Now this toxicology is a scientific discipline which may overlap biology, chemistry, pharmacology and medicine. So this involves the study of adverse effect of chemical substances on the living organism and also the practice of diagnosis and treatment exposure to the toxic and toxicants. So here we won't be talking about diagnosis and treatment. Only our study will be restricted towards the screening methods for detection of these toxicological substances. So now here we have both toxins and toxicants. Let us see the difference between these toxins and toxicants. So both the toxicants and toxins, so they can be referred to as toxic substances. Toxic substances which can cause harm or even it can end the life of an organism or a person. But there is a slight difference between toxin as well as the toxicants. Now these toxins are natural products which are formed in the body of biological system. Say for example, it may be the snake venom which are synthesized in the snake, even the mushroom poison, so they are naturally produced. So these products are called as toxins, whereas toxicants are artificial substances which are man-made products. So they introduced into the environment due to some of the human activity. Examples are industrial waste products and pesticides, but both they have come under the word toxicants. So there are certain guidelines in order to handle such toxicants agents. Now coming towards our drugs also, because dose matters here. So lower dose, even the drugs may be safer, they may not show some of the toxic responses. That's why we will be mentioning therapeutical dose separately and also poisonous dose separately. So now it's a general statement, you will be able to use medicine in a better way if you know not only the advantage but also the disadvantages. So now advantages already we have seen in preclinical studies where we have came across with the potency and efficacy of the drug. So this may be the advantages of knowing it, like you may fix the dose and duration also. Even disadvantages also runs parallelly. These disadvantages are some of the adverse effect and the side effect which can be seen parallelly with the drugs. Even on long-term use, even adverse effect can also be noticed. Even new adverse effect may enter into the list. So as pharmacist, like we should have complete information about both wanted and unwanted usage of the drug. Now toxicological aspects will be encountering about the disadvantages of the drugs, like early precaution, how we can make such regulatory aspects and all we can decide after studying the toxicological effect in a drug. Now coming towards the general information, the father of toxicology is Paracelsus. So he believes like all substances are poison, there is none that is not a poison. So here he mean to say about the dose aspects, everything in the normal dose and or in the low dose, even poison also in the low dose, they won't act as toxicological substance. But as the dose rises, So they start showing its poisonous effect. Now poison word, it represents a killing effect. If you take such substances generally, so they causes lethality. So that's why the poison words we are using. So the right dose differentiate a poison from a remedy. So this is the Paracelsus. That's why we should know both wanted and unwanted effect of a drug. So now this poison is a quantitative concept. It's between benefit and the harmful effect. That's why like sometimes low dose some substances may not show as a poisonous effect. As the dose rises, even what we can say like the healthier and safer substance may act as a poisonous in nature. Even time also, like chronic and acute also. Chronic exposure of certain substances, it may causes toxic effect, but some in acute dose only it may causes toxic effect. Now in this subject we will be dealing with the toxicological testing methods. So up to now we had making information related to the toxicological aspect. This toxicity means we are not talking about the direct poisons here. Even some of the drugs what we are using, for that also toxicological screening should be carried out, because the drug may have efficacy and it may be having proper therapeutic index. Parallelly, if it had some of the adverse effect, so then it may cause a lot of complication with the person who had taken, and sometime it may enter into the next generation, offspring may get affected. So that various degree of toxicological studies should be carried out before entry of the drug into the market. So now acute toxicological studies we may conduct for a shorter period of time. Even chronic toxicity studies, it may be for months together, 90 days studies it may be. Or subchronic toxicity studies where repeated dose of more than 90 days it may be carried out. So in toxicological study, as I told, like the person himself, he may not get affected. Many times like next future generation also may be get affected. So because of the mutagenicity property of the drug, it may happen. Such that mutagenicity test should be carried out for the drugs. When carcinogenicity tests also should be performed. Very recently you might be heard about a drug as H2 blocker, cimetidine, ranitidine. So this ranitidine also very recently they have identified for the carcinogenic property which can cause cancer, and they are planning to withdraw. So earlier, suppose carcinogenic test, if it is carried out, means such complication can be overcome. So they all comes under the toxicological screening. Means here we should not imagine like toxicological screening means separately some poisonous substance we are taking and we are screening it. It's not like that. It's related with the drug, because now already preclinical studies are carried out. With that only, in long term, there may be chance of getting of some of the toxic effects. So that should be identified early and precaution should be taken. So other than carcinogenic test, like one generation reproduction toxicity testing can be done, or two generation reproductive toxicological studies. Many drugs it causes impotence or sterility as a problem, or sometimes the offspring, like you might be heard about teratogenicity complication also. So there may be such problems. So that like generation reproductive toxicity studies can be parallelly done, so that safetiness of the drugs can be assessed. Even developmental toxicity or embryo toxic studies should be carried out. So this may be the method which may protect the fetus also. We can give precaution, suppose the drug is having action, some precaution can be taken while dumping into the market, so that in ladies who are pregnant, they should avoid such drugs. And other like genetic toxicity testing also, where we can screen about the toxic effect which will shows on the genes. So overall this is about the general introduction about the toxicological screening. So here I mean to talk about the toxic substance, means they are the drugs which are to be used into the treatment aspects, but we should carry out toxicological screening also with such agents. In next video I will be talking about the syllabus